Hello everyone. Do you know that an estimated 1.4 billion adults in the age group of 30 to 79 years are living with hypertension worldwide? And this represents about 33% of the population in that age group. Approximately two-thirds of adults with hypertension are living in low and middle income countries, and an estimated 600 million adults with hypertension uh, are not aware of their condition, and only 23% of adults with hypertension can have control of their medical condition. And hypertension is a major cause of premature death worldwide. Let these numbers sink in. I'm Dr. Suhail Durani, internist and consultant diabetologist here at Fortis Hospital, New Delhi, and I want to talk about hypertension, which is a silent killer disease. Now, what's blood pressure? Now, blood pressure is the pressure exerted on the walls of blood vessels, the arteries, by the circulating blood flow as the heart pumps it throughout our body. And hypertension is when this pressure in our arteries is too high. That's 130 over 80 mm of mercury or higher. Now, what are the risk factors for hypertension? There are modifiable and non-modifiable risk factors. The modifiable risk factors include unhealthy diet, consumption of excess salt, uh, consumption of the fat, diet rich in saturated fat and trans fat, low intake of fruit and vegetables, physical inactivity, use of tobacco and alcohol, and being overweight or obese. In addition, there are some environmental risk factors associated with hypertension, among which the air pollution is a major significant risk factor. Non-modifiable risk factors include family history of hypertension, age over 65 years, and coexisting diseases like diabetes and kidney disease. Now, how can one recognize hypertension? We have to understand that most people do not feel any symptoms if they have high blood pressure. Measuring blood pressure is the best way to know if one has a high blood pressure or not. Now, I will talk about certain do's and don'ts if a person is diagnosed with hypertension. Among do's, we should eat more fruits and vegetables, sit less, be more physically active, and engage in activities like walking, running, swimming or cycling. Get at least 150 minutes of moderate intensity exercise each week. Do strength building exercises at least 2 or more days each week. Lose weight if you are obese or overweight. uh, Keep yourself well hydrated, uh, and get a good sleep of 8 hours. Take your medications regularly as prescribed by your healthcare professional. And among don'ts, do not eat too much or excessive salty food. So the recommendation is salt intake of less than 2 grams a day. Avoid food which is rich in saturated and trans fats. uh, Avoid use of tobacco and smoke. Do not drink too much alcohol. Again, the recommendation is one drink max for daily for women and two for men. And do not share or mix your medications. Now, the burning question, the million-dollar question is why we are concerned about hypertension, especially when there are no symptoms associated with it. High blood pressure can cause serious damage to our heart. Excessive pressure in the arteries can harden them, therefore they decrease the blood flow and oxygen to the heart. In addition, uh, hypertension can block or burst the arteries that supply blood and oxygen to the brain, leading to stroke. It can also cause damage to our kidneys, causing kidney failure. And similarly, It can damage the retina of our eyes and can lead to vision loss. To know more about hypertension, please visit our center and meet our experts. Thank you.